Welcome to session number 3 of the ITP Psychology Group with Dr. Andrew Morgan, the Principal Clinical Psychologist from Liverpool University NHS Trust. Thank you for joining us, Andrew, for this third in the series of 3 meetings. The first two, we were just looking at the numbers for the views on YouTube are tremendous. So thank you everyone for taking part. As always, this meeting is being recorded, so others can actually watch it at their leisure afterwards, as can the people who are already ITP patient mentor, Mrs. Rhonda Anderson. Rhonda is a valued member of the ITP Support Association and always supports us with these online groups. Welcome, Rhonda. Okay,
Thank you.
over to you.
Hi, everybody. Welcome back to the third and final session of this group. Before we get going, apologies in advance. I'm a little bit under the weather, which means that my voice is a bit rough and I'm not firing on all cylinders. So forgive me if I'm a little bit slow today or if I need to take a sneezing break or something. But I thought what we'd start with, same as last time, is just a quick overview of what we've done so far. Then the main bulk of our time is going to be the Q&A. A final call as well for anyone who has any feedback for us, whether it's positive or constructive. It's really valuable because we're doing something a little bit different here, and I've not seen this really done before. So your insights of how it could be different or better or what you liked about it really will pay off for us in the future. So please, if you have 5 minutes at any point, just write down even just a couple of points would be great. So what we've been doing so far, these first 2 sessions, is I've been introducing a taste of what psychological therapy might look like, the sort of things I would do with a client, and based on a model called acceptance and commitment therapy. And that's this idea that the most important thing in terms of psychology is living a meaningful life. We'll talk a bit more about that today. It is a group about ITP, but as I always say, my experience of doing this work is that all of psychology is connected. So many of the people I see in my job who are stressed about ITP, they also have other stresses in their life, and the things that are helpful for them cut across all sorts of different problems. So if you have anything to talk about today, whether it's in the Q&A or any time, and it is not strictly related to ITP, please bring it up because it can still be very instructive and useful for everyone. In terms of group principles, like Mervyn said, this is recorded, so it's not confidential. Only talk about the things you feel comfortable talking about. If anything difficult does come up for you, you're feeling upset, I would recommend you talk to a loved one. If it's related to your care, then your clinical team. And if you or anyone else is ever feeling like things are getting pretty serious, then your GP, or in cases of emergency, 111 is what we recommend nowadays. So instead of 999. Turn your camera off if you'd like to. I know some people prefer that. Leave if you'd like to. I certainly won't take offense about that. There's no need for anyone to contribute if they don't feel like they want to, but any contributions are tremendously valuable. I'll talk a bit more in a bit about this idea that you guys are the experts in living with ITP. Of course you are. So, you know, you'll have insights to share from your own lived experience that could be incredibly valuable to other group members. So please share them if you feel. If you don't, then just listening is a valuable contribution in a group as well. If you do have anything to say, just jump in. It's hard for me sometimes to keep track of the hands whilst I'm presenting, so just talk over me and we'll just deal with that as it comes up. Okay, so quick recap. When we first met session 1, the big idea was my claim that overthinking, worrying about the future, ruminating about the past, criticizing ourselves excessively was probably the main way, in my opinion, that people make life harder for themselves than it already is. Life's given us a big pile of stress, namely in the form of ITP and all the other stuff we have going on in life. And if we overthink about it, then we're just adding more stress that doesn't necessarily need to be there. The alternative to overthinking, one of the main ones, is being present. When we're present and engaged with whatever's in front of us, whether that's a conversation we're having or the taste of our dinner or a hobby, activity, whatever it is, then we will not be overthinking about our problems, and we'll also get more out of life. Life will be more satisfying. It's two birds with one stone. So choosing to be present rather than overthinking. The second session, we spoke about this idea of values and valued living. I mentioned a moment ago that acceptance and commitment therapy tells us that the most important thing in terms of psychological well-being is living a meaningful, a valued life. The idea here is that when we're connected with our values, when we're doing things that matter to us, when we're being the sort of person we want to be, it's much easier for us to meet the challenges of life. It's much easier for us to deal with stress when we feel like there's a point to it. We also spoke about this idea that, in my opinion, again, people have a variety of needs. We'll have one or two things in our life that we spend most of our time and energy on, whether that's our family or work or whatever it is. But we'll have other needs too, things like fun or spirituality or being outdoors or whatever it is. And my model of valued living involves attending to all these different bits and pieces and making sure we have a well-rounded and meaningful life. So I showed last time and sent round a worksheet, the point of which is to help people to think more explicitly about what things they do care about, what are the sorts of things in their life, the itches they have that would feel satisfying to scratch, if you like. So that was what I left you with last time, and an invitation to have a look through that. So before we talk about that specifically, any general thoughts, comments, questions, anything arising from the stuff that we covered last time? Anyone would like to share? No, all straightforward and makes sense to everyone. Okay, so did anyone
Andrew,
have
there's been some comments on various, like, social media channels this in the last few days
okay.
about um, uh, fatigue and spoon theory. Now, I know you touched on spoon theory in one of the talks.
Hmm.
Could you just, like, give us a recap of what that is, so, like, people are aware of it?
Yeah, it's not an idea that I particularly use very much, but I've actually got a colleague who was telling me a bit about it the other day. I think the general concept is the idea that we need to be wary of measuring out, doling out our energy. When we're feeling fatigued, we only have a certain amount of energy to spare, energy points to spend, if you like. And one thing you notice a lot, I notice a lot in my clinical work, is that partly because people are so committed to the things that matter to them in life, is that they will feel driven to spend more energy than they have to spare on that thing. I was working with someone with ITP just this week, and she wants to walk her daughter to school every day, even though she doesn't have the energy to do that. And so what she's noticed is when she pushes through that and says, well, I've got to do that because I want to be a good mum, that's what's important to me, then the whole next week she'll miss out completely. And so what we've been working on is that when she notices that push to do more than she has energy for, using the refocusing, the being present to allow her to have a rest, take her daughter 2 times a week, 3 times a week, so that then the week after she can do the same again. So this idea about not overthinking in terms of self-criticism that leads us to exceed the amount of energy we have, and then in the end doing less of the stuff that matters to us in the long term. So that sort of idea that it's a marathon, not a sprint, something like that.
Great
Does
stuff. Thank you.
anyone have any experiences that are similar to that? It's something that comes up a lot in my clinical work, that idea. Does anyone that resonate with anyone here?
Sue, I believe you want to say something?
Yeah, it does. I know myself that I suffer from fatigue a lot of the time. And, the exhaustion can be overwhelming. But knowing you've got to go to work, you know that you've got to do different things. And most of the time you just push yourself, but then suddenly you hit that brick wall and you can't do anything more. So the spoon feeding idea of pacing yourself, I've learned to pace myself, but I think I've done it subconsciously now, I think I'm not going to do that, because if I do, I'm going to be too exhausted to do something that I really need to.
to do.
Do you
Okay.
ever find, Susan, that you notice self-critical thoughts when you are trying to take a rest? Any thoughts come up in your head about, well, you should just do this anyway because you used to do it, or if you were stronger, you would do it. I hear that a lot from my clients, that sort of thing.
I think a lot of it is because the nature of ITP, you look perfectly fine.
Mm,
You look well. People say, oh, you look really well. Oh, and it's very hard to explain to them because they don't get it.
mm,
When you try, people just don't get how you feel with ITP, because it's something that they probably, hopefully, will never experience. I think the only people that understand is people that have been through chemo, and they understand that same type of fatigue. But we look fine. We can look really good sometimes, and people think she's fine, and just don't quite get it, that that you're actually battling to do that job, not just, oh, hey ho, I'm going to do it now.
Yes, certainly. And I've even heard from people where sometimes they will tell me that because they think they look fine, they can sometimes question themselves and
Yes,
think,
I agree.
is this part of my illness? Or the same client I was speaking about before would sometimes say to herself, looking in the mirror, I think you're being lazy,
I
you
I
know?
to- I, I to- totally agree on that one.
Mm. What
It's a very
such a
strange illness. Because it's rare. I just don't think people understand it. Because you look well, to all intents purposes, you are fine until you think, oh, your friends will say, oh, we're going to go on holiday. Do you want to come? And then already you're starting to overthink, oh, what about insurance? Oh, before I go, I better see if there's a hospital near there. I better do this. They haven't thought of that. They've just thought, we book a holiday.
Mm.
It's very different. You lead your life very differently to a person without ITP. That's what I have noticed.
And what you've just said there, Susan, rings a bell for me. I was just reading a research paper in the past couple of days where one of the comments was about ITP. One of the comments was that lots of people who have ITP in this research said that they don't feel like they understand it very well, or certainly they didn't at the beginning. And that one of the things this research paper recommended is that clinicians get better at explaining it and explaining what they know about it, but also explaining to people with ITP the stuff that clinicians and psychologists just don't know or understand about it. That there's a good deal of mystery about it too. So it puts people in a very tough position. I think that one thing that came to mind when you were talking is that word fatigue. It's one of those tricky words where it has multiple meanings. And you
Mhm.
talk to anyone off the street and say, do you ever feel fatigued? And they'll say, yeah, I've had a really busy day at work. I just want to put my feet up. That is not the same as the sort of fatigue we're talking about here, right? We're talking about with
Yeah.
ITP, chemotherapy, other physical health issues. And so even just the language, I think, can provoke self-critical thoughts in people. Because it looks like the same thing as other people are experiencing, but it is very different, not just more intense, but I think almost of a different sort of quality. Can anyone else relate to what Susan's just said there?
While Susan was talking, I saw Sue Hapgood nodding her head in agreement.
Hmm.
Sue, you're muted.
Can you hear me now?
Yes, you can.
Yes.
Yeah,
Oh, great.
yeah.
I've had ITP since I was 20, in my 20s, and I'm now 70. So, I've had a long number of years of dealing with this. And Yeah, I empathise with Susan a lot actually over the course of those years. It's not easy to explain to others, but a bit of a plug for the ITP support thing. If I go into any, even if I go to a new GP or want to explain something to somebody, I often take the ITP leaflet with me just to give me some kind of credence that what I'm saying is, you know, um, medically correct. And I'm
Actual,
not,
yeah, yeah,
yeah,
yeah.
and um, hmm, I don't know what else to say really, but I did have a lot of empathy with what Susan was saying. Um, and I've really found it useful with this ITP, the social media for the support week, all the um, posts that have been coming out, I've been forwarding them on to everybody I know.
Oh, you're the one.
Going, this is what I've got. If you know
Mm,
anyone, please, if you know of anyone. And actually, two friends have come back and said, yeah, they know someone that's got it, and they were so
mm,
pleased to be able to pass it
mm,
on.
mm.
So I don't know, but yeah.
Yeah,
Um,
like you've had it 50 years, Sue, or nearly
oh
50
God,
years.
yeah. How
Yeah.
where's that time
So
gone?
I know. So in during that time,
Mm,
has there been any occasions where what Andrew's been saying about how you cope with the psychological aspects of fatigue,
mm.
where that's hit home and you can understand that, you can empathize with that?
It's really hit home, Irvin. Yeah. I did go through a phase of being quite depressed at one point. Um, because I'm quite a active person and I like walking and I felt that the things I really wanted to do, I couldn't do. Um, and I thought, oh gosh, what's life left for me? What have I got left to do if I can't do this or I can't do that? So, um, I sort of turned it round a bit and think about what I can do, really. And
Mm,
like you say, if you conserve your energy for the things you really want to do, instead of, yeah, pushing yourself too much sometimes. But it's hard to explain to people. I really do get that, especially when I was working. I'm retired now. But yeah, sometimes I just say, look, I just can't do it. Yeah.
yeah, yeah.
Sue, can I ask, because you've really hit the nail on the head there with that example of what we were talking about last time, this idea of values. The
Mm,
ITP put up an obstacle between you and something that mattered to you,
mm,
and that was a psychological blow.
mm,
That it sounded like what you were saying is that, and then you managed to get around that and find other things that you cared about and that were meaningful.
mm.
If it's not too personal a question, could you tell us a little bit about some of the things that you found that helped to replace the meaning of the walking and that activity, or maybe just complement it?
Well, instead of thinking, oh, I've got to do a 10-mile hike like I used to love doing, I sort of do 1 or 2 miles if I can make it, and I just stroll. And I found people that are quite happy to stroll with me, and I've got places I can sit down along the way. I love going and sitting in a bird hide because I'm an outdoor
Mm,
person, so that doesn't take a lot of energy. That's quite relaxing. I've been on some recently, they've got mental health and well-being, a lot of that with being out in the countryside, and there was bird watching for relaxation and all sorts of things. So I try to network as much as I can and find out what's going on locally and see if it fits me when I'm, whatever I'm fit, however I'm feeling. But I am a good one at networking and finding out what's going on. I've lived in this area for a long time, so a lot of people know me now, and I just I try to stay positive because if I get negative, then it doesn't help me really.
Mm.
And I've got friends that I can talk to. Um, I don't really know anyone locally that's got ITP, but I have got a lot of support from the ITP support group at times, and I've loved coming to the conferences because that makes me just feel so empowered. And when I came before, in the London one, I was given a leaflet which tells you how to explain to your GP or your consultant what you're worried about. So you write down all your thoughts and then you talk it through with your consultant. Well, he'd never seen anything like this, and he actually took it away with him at the end. But you know, um, yeah. I don't know if
Yeah,
I'm answering your question really.
You are, Sue, and you're going further than that, right? Because as I said before, the most valuable sorts of insights are from people's lived experience, right? And you've just given, in my
Yeah.
opinion, a beautiful example of how this psychology stuff works, right? As we
Mm,
said before, when someone has an aspect of meaning that's taken away or that they're removed from, even if it's temporarily, it can cause big psychological effects. Use that word
mm,
depression. I hear a lot about anxiety, that kind of thing, self-criticism, as I say. And the way I would understand what you did was that you made adaptations to the thing you used to do to
mm,
capture as much of the meaning as you could. And then you complemented it with other things. You've spoken about being social, you've spoken about nature and the bird watching and that kind of thing.
mm,
So it fits perfectly with what this psychological theory is trying to tell us.
mm,
And this idea of thinking proactively about our values, what matters to us, and then setting out action plans, this spoon feeding of, well, I'm going to spend one spoon on this week, and then next week I'm going to go and see my friends bird watching because that'll be another spoon there. And making
mm.
sure that when we're distributing our energy, we're scratching those itches that we have. That's the thing that can help people to feel like, even though I'm in this very tough situation, life is still meaningful. It's still a good reason to be positive, to use your term from before. So it's a beautiful example of what I was trying to get across. So thank you for that.
Can I
Um,
just say one other thing? It's hard to say
mm,
no sometimes. I find that hard. People want me to do things for them, and I have to really sort of go because I don't like saying no. I don't know if any people find that, but you get asked to do things and you go, actually, instead of saying yes, which I've done most of my life, I've got to learn to say no, I can't do that this time. Yeah, that's hard sometimes, isn't it?
Well, if I could just come in there, I would like to say that, it's fantastic all the things that you've found to adapt to living with ITP. And I think that's, very helpful for anybody who's living with anything really that's difficult.
Mm,
Because, I mean, ITP is unique, but, a lot of people have similar things. And last time were you on last time, Sue?
no, I've missed the first two, so I'm a bit out of it really, but
Oh, okay. Well,
I've picked up the general.
I'll just tell you what I said last time, which I think people thought was quite helpful, was if you're doing something, anything at all really, but I mean, it wouldn't be something that took a long time. You just spend a short amount of time doing it. So you might give yourself 10 minutes to do
Mm,
something. And then if you feel okay, you can put a timer on. And if you feel okay, go on and do a bit longer. You might do another 10 minutes. So you might say, no, I'm going to stop now. And you don't have to do more than the short amount of time that you've allocated. And then you
yeah,
feel the satisfaction of having achieved whatever you're doing in that short time. And then you can do that maybe another part of the day or the next day or the next week. And it's a way of sort of allocating time because some people find it very difficult to do tasks in the house because they just feel
mm,
very wiped out.
mm.
So that is a good one. It is actually a whole thing called the Pomodoro method,
All right.
which you can look up. But we in the expert patient program, we have adapted it just to say, just do your 10 minutes with your timer or whatever
I,
time you choose.
I suppose that way you get to feel good about it because you've achieved your target. Whereas if you'd said,
Exactly.
I was going to keep going, and then you feel a failure because you haven't done it. You know what I mean? You've set
Exactly.
yourself a small step, I suppose, instead
Yeah.
of a,
And
yeah, I
that's
got it.
called an action plan. So
Okay.
you do an action plan, which is something that you can do, that's something that's possible, something you want to do, and
Yeah.
something that you're going to do maybe 3 times a week.
Yeah.
And then
Okay.
you progress through that, and it helps you to be able to feel some achievement.
Great. Thank you.
I'm really interested in what Sue said there. We've already heard a similar thing a couple of times today about the challenge of saying no. and saying no to other people, saying no to ourselves and our instincts. You know, I work with a lot of people who are very driven, whether that's driven to do well at work or keep a clean home or whatever it is, and being able to say no and take a rest when it's the most helpful thing is one of the biggest challenges, if not the biggest, for a lot of people. Has anyone had any experience of saying no, either to other people or to themselves, and any ideas about what's worked well for them or what they found challenging about it?
I think you always feel you're letting someone down if they ask you to do something. And I think it depends very much if you say yes or no, is when you actually, how much investment you've got in that person. And if it's somebody who's close to you or somebody that you really respect and you really want to help, it's almost impossible to say no. But if it's somebody who's we don't know that well and they ask you to do something that's going to take a lot of time or effort. So my next door neighbour, who I don't feel particularly invested in, although, you know, we've lived side by side for some time, if he asks me to do things, I usually find an excuse to say no.
I hope he can't hear you through the walls, Rhonda.
And I don't think he can hear me.
This is being recorded, Rhonda. Remember that. So.
Oh yes, but you know, I mean, that's nothing bad.
No,
I mean, you know, but I think that is the problem. It's like decluttering. You know, you can't get rid of the stuff. You can't get rid of the stuff that you've got emotional investment in. Whereas if it was the wood down the back of the garden that we got rid of, the old fence, and we packed it all up one day and we took it to the dump the next day and we were glad to say goodbye to it. But I wouldn't feel like that about most of the things I've got.
And have you noticed anything through your experience, Rhonda, things that you've done which have been helpful to help you say no, even when you do feel closely connected with the person?
That's a hard one. Because I usually say yes. I'm, you know, I find it really difficult to say no.
What I've done, I'm finding this technique which is helping me a bit. So if I'm having problems making a decision or doing something for myself that is good for me, but it goes against what other people might want, I say to myself, if I was my own best friend, if you could see, so my best friend theoretically stood next to me and I'm pretending I'm them. Well, I can't explain this very well. And objectively, I'm looking at myself and thinking, well, that's not right. So you've got to look after yourself. I can't. Can you understand what I'm saying?
Yeah. I can, Sue. Yeah,
so
that's it.
Yeah. So I just find that handy because I think, right, I've got the courage now. I can see that I've got to do that to make myself feel better. I'm an important person, and I even though it might upset this other person, I feel this is the right thing to do for me. Yeah, something like that. Yeah.
Well, that's the advice that I give other people, that you're very important. You have to look after yourself.
It's hard to do though, isn't it, Rhonda?
Yeah, very hard.
But I have found that technique a bit helpful sometimes when I felt a bit in a defensive mode, you know, thinking, oh, I suppose I better say yes. And then I'm thinking, don't have to really. Yeah.
You will be amazed how many people do something very similar. I myself, my best friend, sadly, is no longer with us. He died a few years ago now, 9 years coming up this week, funny enough. When I've got a challenging situation, I have a voice in my head that's talking to my mate Dave, and I say, Dave, what would you have done in this situation? And I actually hear his voice speaking back to me.
Oh, wow, that's a good one.
And it helps all the time. It can be a pain in the backside sometimes, but it helps. It does help. It does help.
Yeah.
So yeah. So I'd just like to go back again. You know, you mentioned 50 years. In that
Yeah.
time,
Mm-hmm.
how have you noticed the changes in how the condition is, first of all, looked upon by the NHS in particular, GPs, consultants, etc., but also how it's been treated? You must have seen, the complete about change of, the treatment pathway coming along.
I suppose when I got it, I was put on the 3-month steroid. If you don't respond to that, then you go and have your spleen out. And then if you don't respond to that, you're one of the unlucky few, then let's see what else we can do for you. And I was lucky in the sense that I was unlucky that the spleen operation wasn't really worth doing. Well, it might have been a bit, but my platelet count still stayed low. But it stayed at a level really most of my life where I haven't had to have too much other treatment. If my platelet count dips really low, which it has done on quite a few occasions, I've just gone on to steroids for a very short time and I've responded to them. But I always feel fragile when that happens, and I go along thinking I'm okay, and then I feel fragile at that point. So with doctors, I've had when I went to New Zealand on holiday, a long time ago when I first got diagnosed, but I was over the operation and I was, wasn't taking steroids, it was just off everything. I got a bleed when I was over there, and they 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 did the cutting thing. They cut my arm to see how long I'd take before I
Oh God.
clotted.
This was in New Zealand, was it?
Yeah,
Well,
that's a long time ago. That's a
yeah,
long time ago.
I know, but they haven't advanced very much in New Zealand.
That's
A
1980.
good, a good
1980 that
friend of
was.
mine,
Mm.
ITP Australia, has now taken over New Zealand, and she's been fighting like mad, to get them not to have spleen removal as one of the options still.
Yeah.
And they're still not allowing TPOs at the moment, but she's nearly there with that. So yeah,
Oh, good luck
yeah,
with that. I was
yeah,
gutted when my lovely spleen was taken out. I
yeah,
can't vent
yeah,
my
yeah,
spleen on
yeah,
anyone.
yeah. And it's like, going back to what you just said about
Yeah.
the trauma with the steroids for 3 months, etc. And the
Yeah.
third point on Andrew's um, slide there,
Mm.
examples of successes and challenges,
Yep.
it's been extremely challenging
Yeah.
coping with the effects of that treatment.
Mm.
The steroids, probably can't sleep and all that. Highs and lows, weight gain, moon phases.
Oh, it's horrible.
Yeah.
Yeah. Um, I had COVID and COVID jabs, and they think that because of that, my platelet count shot down. They can't prove it, but it seemed to coincide with that. And it went from my normal sort of between 30 and 50 down to 10, and started getting nosebleeds and all sorts again. And then I got put on these steroids, and I was high as a kite again. I go high as a kite. I just, I could talk the hind legs off a donkey sort of thing, and hoover the house in about 5 seconds. But
God,
yeah,
God.
yeah. So it's the opposite of feeling tired.
Yeah.
Well, mentally anyway. You feel exhausted afterwards, mind you, but
A real challenge though. Yeah. Yeah.
it's the mental thing, and knowing I don't. I try to sort of see steroids as something that's helping me, but I envisage them as poison. So that doesn't help, does it?
Many people do now.
Um,
Yeah. Yeah.
yeah, I don't like them at all, but it did work. Oh, and then I got, oh, Stan, you don't want my life story. I haven't got time for that. But basically, I was on holiday, and I got so slowly taken off them. There's a lovely newish consultant at Musgrove called Dr. Best. And while I was traveling down to Cornwall, having almost come off the steroids, I started getting bleeding and blood ulcers and all that sort of thing again. So when I got down to Truro, I rang him up and he said, "Get yourself to Truro Hospital." So I went there, A&E and all that sort of jazz, and waited ages. But eventually I did get seen by person there, and they were quite worried about this low platelet count. I don't think they probably have many people there with it.
No.
So the next morning, Dr. Best rang Truro Hospital to explain. They said, no, she doesn't need another blood test. No, she just needs this. She just needs that. And they liaised quite well at that point. But that was all a bit traumatic.
Yeah.
But
It's a challenge you can do without, isn't it? Like,
yeah, I mean, I was telling them what I wanted, but they wanted to do their own little tests first, you see. So I suppose they were duty bound to do that.
Okay. Sorry, Andrew, back to you, sir.
No, it's all about people's personal experience. It's very interesting to hear. I just wanted to. We're basically in the general discussion part. There's a couple of bits I want to pick up on before we move into it kind of fully. And the first thing is to say that, yeah, Sue, your idea, your technique of imagine I'm my own best friend, like Mervyn said, it's one of those things that makes me as a psychologist think, yeah, we're not telling anyone ideas that other people don't already spontaneously have a lot of the time. It's exactly the kind of thing I would recommend to my clients. So for you to have come to that yourself just speaks to how kind of universal a lot of this stuff is. And one of the variations on that technique that a lot of people find helpful is, what would I say to someone else that isn't me? And the reason why is because a lot of the people I work with, they're far more compassionate to others than they are to themselves. Something about humans, it's like in our mental library, our kind of compassionate sayings to other people are filed in a different cabinet than how we talk to ourselves. So it takes a bit of effort to kind of go to the other people cabinet, bring those compassionate ideas back and stick them in our own drawers. And so, yeah, imagining if it were my friend in this situation, if it was someone I loved, what would I say to them? Is exactly the kind of thing that we do work with people on. The other idea that my clients tell me is helpful from time to time is this one, and we're talking here about saying no, either to other people or to ourselves, is this idea that many of us are, like Rhonda said before, other people are important to us, but many of us are very important to other people too. That's why they want to spend time with us, right? That's why they need our help. And you can imagine it's a bit like a tree, and you're the trunk of the tree, and these people are the branches. That any investment that you put into yourself is only going to pay dividends for those people later on. If someone who is relied on by others burns themselves out because they say yes, yes, yes all the time, all that's going to happen is those branches are going to suffer as a result. So that idea of reconceptualizing self-care as not a selfish act, not just an investment in ourself, for our own sake, but an investment in the whole system around us, all the other people that pay dividends in the long term. I think that way of thinking about it can help people to make those longer term decisions, even when their minds and bodies are telling them, no, you should do this now, even though you're tired, push through. The final thing I wanted to say, just because, if anyone has looked at the worksheet, to do them justice, it wouldn't be fair if I just moved on straight away. So just to ask, did anyone look at it? And if they did, what did they think of it?
Yeah, I had a look at it.
What did you make of it, Rhonda?
Well, I don't really like talking about myself or evaluating myself and putting it down on paper, to be honest, but that's just me. I think quite a few people might feel the same. And I find it very hard to do numbers 1 to 10 on anything. So I think I would have had quite low numbers about myself, but I didn't actually fill it in as such, but I did look at it. So I think where it says, what sort of family member do you want to be? Well, of course, you want to be the very best you possibly could be. And then what personal qualities would you like to bring to those relationships? Well, it's probably harder to talk about your own personal qualities. And what sort of relationships would you like to build? Well, obviously, you want to build nice, positive relationships with people, especially those in your family. And how would you like to behave towards your family? Well, you know, you'd like to be the wonderful mother figure, wouldn't you? The matriarch of the family. And but I know that I'm not. So, you know, it's all a bit of self-evaluation that can come out somehow slightly negatively towards yourself. So I don't know if I would, I think perhaps other people might, not on the family one, but on other things, might score me a bit higher than I would score myself. On the family one, I think I might get some quite low scores.
Well, there's a few things there that you said, Rhonda, that are interesting and that resonate with me. I've done this many, many times. The first one is, of all the things I ask people to do in therapy, this is the one that on average people find the hardest. The idea of reflecting on themselves and what they care about. Those questions are the toughest ones. And I have a general principle in therapy or psychology in general, which is that the things that we find most difficult are probably the areas where we're going to get the most benefit from investing our time and energy. Because, you know, the things that come naturally to us, of course, we want to do more of those. You know, they're easier for us to do. And the sticking points are generally the areas where as I say, we can get the most gains. There was, forgive me if I said this last time. My job basically involves repeating myself about 10 times a day, but I remember doing this with someone. It speaks to what you said, Rhonda, about this idea of, well, obviously, you want this, you want that. I was speaking to two different men in separate sessions, and both of them said, I want to be a really good dad. Okay, brilliant. What's that mean? What sort of dad do you want to be? And the first one said, well, I want to be there for my daughter. And the other one said, well, I want to be there for my daughter. Okay, well, what does that mean? Well, if my daughter calls me at 4 a.m. in the morning to pick her up, I'll go and get her. If she needs some extra money because she's, you know, having a tough time at work or with the rent, I want to be there for her, give her the money. The other guy said, I want to be there when my daughter needs someone to talk to. I want to be there when my daughter has something that she can't confide in anyone, and I want to be there to be trustworthy for her. So once we dug down of what does that mean, what does that mean, what does that mean, we got to a place where both men wanted to be good dads, but their idea of what that looked like was very different. You know, and the reason why that can be helpful to understand about ourselves, the specifics of it, is that then when we're doing our action plan, like you said, Rhonda, we can target it. You know, what does a good dad who's there for his daughter do next week? Does he give her a phone call and say, how are you getting on? Or does he go around to the house and do some DIY for her? Like those two actions, quite different and scratch different itches for these different people. And the other thing that I would say is that I find that in my work, a lot of people are a bit shy in giving themselves credit for the things they already do and they're already not good at, but you know, they're already consistent with their values, that they're already being the sort of person they want to be. One of the things I hear the most is I work with someone saying this, I've not got anything going on in my life, I'm not a good person. And I'll say, well, you were just telling me that you get your kids to school every day and they're well fed and they're loved. And they'll say, well, you've got to do that, haven't you? You've got to look after your kids, almost kind of minimizing it. And what I'll say to them is, believe me, I know from my work that you don't have to look after your kids. I've worked with lots of people in my career that didn't do that, either because they didn't care about it or because they weren't able for various reasons. In other words, I want my clients to give themselves credit for doing some of the hardest things in the world that from their perspective should just be a given. Because goodness knows we're not shy in coming forwards about the stuff we feel like we're not good at, or we're letting ourselves down. So it takes more of a mental effort to say, well, this is what I am doing that's good. And like everyone was saying before, generating that sense of, if not confidence, then kind of momentum, a belief in our ability to be this sort of person we want to be by noticing the stuff we're already doing that is consistent with our values. Okay, I don't want to take up any more time talking about last time. And we've already talked about some general stuff, and I want us to crack on with that. I've already said most of this. The point here that came to mind, we were discussing things earlier. One of my mottos is that lots of things in psychology are simple. It's our job to make them simple. It doesn't make it easy. Saying no to someone is never going to be easy, right? Doing the things that matter to you is never going to be easy. So I don't want to come across like, oh, well, here's what you should do there. Just go and do it. Not easy, right? So picking up where we left off before that little detour, does anyone have any questions or thoughts or comments that they brought for today about psychology and ITP? We've already covered some really good stuff thanks to our contributions, but does anyone else have anything?
Diane?
Hi, I'm Diane. I don't have ITP myself, but I'm the grandma of a 4-year-old who developed ITP about 6 months ago. And sadly, he's not one of the little boys who gets better immediately. He's one of the little boys whose platelets are still under 10. They've never been above 10 since he was diagnosed. And the first thing is a comment, really, and it's that the first set of doctors looking after him just kept saying, "Oh, he'll get better, he'll get better." And, by this time he was bleeding into his urine and stuff. And rather than saying, oh, this, actually this isn't going quite the way we expected it, and being honest with us, they kept just saying, oh, he'll get better, he'll get better. And we lost all trust as a family. And the next doctor we went along to see said, after she'd done a few investigations, said, okay, this is what he's got. She did more investigation. I don't know. There aren't enough kids with this particular variant of ITP. I don't know what the future holds. And actually, we found that bizarrely far more reassuring, because we felt at last there's somebody who understands how worried we've been about this child. Because we'd looked on the internet, we knew he should be getting better and he wasn't. So that was a comment. But my question is, poor lad, he's 4. First few blood tests, absolutely fine. We distracted him with his iPad thing. But now he's got really bad needle phobia. What can we, you've got any hints and tips about what we can do about that?
Yes. So there is some, like my first thought is if it's really bad needle phobia, then he should probably be best off working with a psychologist on that. That's one of the specialties
Yeah.
that we do, and especially a child psychologist, right? Because you have
Yeah.
psychologists that work with, say, 16 and up, 18 and up, someone like me, and then you have ones who specialize, they only work with children. And that will be perfect for this. And there's a couple of therapy approaches, not so much acceptance and commitment therapy, actually, that can work really well for that. And I can give you the names of them if it's potentially helpful. One of them is cognitive behavioral therapy, which is the most famous type of therapy, called CBT a lot of the time. It's got a bit of a bad rap because it's used for adults with depression and stuff like that. It might not work so well, but in stuff like phobias, especially with children, it's a good way to go. And the other one is called EMDR, which again more famously used for trauma, post-traumatic stress, but it works also with phobias. So yeah, depending on what the hospital is like, certainly I can only speak for Liverpool. If he were in a Liverpool hospital, there'd be psychologists there who could see him, do specific work about needle phobia. It would be right in their wheelhouse, and they generally would get good results of that. And it would be seen as a priority because, that's one of the reasons they pay us, is to make people's hematology treatment better. So
All right, I'll mention that to the parents then.
Diane, just very quickly,
Yeah.
if you email me your postal address, we have a little gadget called a Buzzy.
I've seen that. I've seen
Yeah?
the advert.
I'll
Yeah,
send you one.
yeah. Well, okay, all right. I will do them,
Yeah.
Mervyn. Yeah, yeah. We'll see. Okay.
They do
So-
work. So
Yeah.
yeah.
Yeah, well, I think it's a pity it wasn't used initially, something like
Yeah,
that,
yeah.
because then we wouldn't have got into the state we got, because he needed IVIG at one point, and so then he was having cannulas put in, and I think that just, well, the whole thing. So the next question was, how do I, so when I live 300 miles away from him, but I go and visit fairly often, and he calls ITP bruisey bruisey. And he says to me, 4.5, Grandma, when's my bruisey going to get better? And I say, well, just give it a bit of time. And he says, well, how many more minutes, Grandma? So how do you deal with this uncertainty, really, for a child of this age?
Well, I would say that, principle, whether you're working with children or with adults, is that people are different, right? There's no one approach that works for everyone. So you will know, come back to expert by experience, right? You will know what his personality is like. You will know his developing understanding of how he sees the world and all the rest of it, right? So that's the basis. Also, as I say, something that the psychologist could help with. But what I would point to straight away, Diane, is your comment before that actually you used the word bizarre. You said bizarrely, it made us feel better when someone was honest with us about the uncertainty rather than giving us an explanation that we felt like didn't really fit with what we were going through. And as I say, I don't know the lad, so I would never advise how to speak to him without knowing him, but just something to reflect on is that if that was comforting for you and having it laid out for you that there is uncertainty there, then it's a potential option as well for working with children too.
Okay, thank you. And my last question really is, so he's 4 now. Hopefully he will grow out of it. We don't know, but hopefully he will. Chances are that he will eventually. How much of this is he going to remember? And if he does remember or have problems with it, is it worth having psychological treatment later on when he's older to try and unpick it all?
You would only know if the memory, he probably will remember some parts of it. Now, come back to theory about how memory works, is that especially when people are younger, their memories are often not formed in the way we would think of a memory as a story with a beginning, a middle, and an end. He might have memories like flashes of images, like we all do, presumably. I know I do. Flashes of images of when we were young. My dad's face when he shouted at me that time, or the time the cat scratched me when I chased it under the oven. Like, I remember that, but I don't remember where I was or what I was wearing or what day it was or anything like that. So he might have fragments of memory. You won't know, no one will know if that's impacting on his quality of life or his well-being until later on. Sometimes, and in rare cases, those things do come back to people later on in life. For example, let's say that at age 18, someone in a similar situation went and had an injection at a hospital. They might remember, in other words, the images might come back from when they were a child. I deal with that quite a lot. It's uncommon statistically. It doesn't happen to most people, but it's not rare in a psychology service. On the other hand, the vast majority of people, that doesn't happen to them. It just kind of comes out in the wash. One of the things your mind does is it naturally processes difficult experiences. It's kind of like a washing machine. It'll launder your memories and clean them out. So there's no need for concern, I would suggest. But it's good to be aware that if he did have those experiences later on, then you would have a good idea why that was. Could make sense to them and normalize them. It's a natural and understandable thing. And then, yeah, psychologist could be helpful in those situations. But so many kids that age who are going through this sort of thing, go through the sort of experience you're describing, and it is by no means a reliable predictor of problems later on. In fact, for a lot of people, these sorts of stressful situations or whatever it is, they have them later on. What happens is they overcome them and they become stronger because of adversity, right? Because he's got the support of his family and all the rest of it. There's an equally good chance that he would come out stronger from this psychologically and whatnot. Does that make sense?
Yeah, it does. Thank you very much. It's really helpful.
No, you're very welcome.
Thank you, Diane. Any other comments, anyone? Okay. Just to highlight a couple of bits, Sue mentioned she took a paper with to a consultation, and it listed out some questions, etc. Helped to guide which questions to ask her consultant. I've actually put the link to it in the chat. It's the ITP discussion guide. I also put the link to a shared decision-making toolkit that was also mentioned about the booklet that is taken to these consultations that shows the GP and the clinician, etc., all the details about ITP. And Rhonda also mentioned the Pomodoro method, the time management technique. I found a link on Google for that, and I put that in the chat as well. And that is very interesting. So I'm sure, there's lots there to keep us all engaged. But if anyone has got any more questions, please shout now. Sue, you're muted.
It's not a question, but it's about another fact, information sheet or bit about when you go to the dentist. I found that really helpful when I went to the dentist.
Yeah.
And the dentist, as a result, I mean, she's highly trained anyway, aren't they? But she did liaise with my consultant just to make sure it was all okay for me to have a tooth out. But it just helps a bit,
These days, most dentists are actually quite clued up on it, thank God.
That's all right.
Because of the profession they're in. But which is good. So yeah. Thank you for that, Sue.
Just a note, Mervyn, that the last thing I wanted to say was I put a book recommendation in the chat. It's a self-help book. It's really good. It's the best book about acceptance and commitment therapy. So if anyone was interested in picking up this paperback to take forward some of this stuff, might give you some ideas or things to work on, check it out. It's called The Happiness Trap by Russ Harris. It's in the chat. So yeah, that was my final contribution to the whole
Great stuff. Okay, well, I've actually got a 70-year-old's birthday party to go to rush off to, and I've got to help her blow out the candles. So it's my granddaughter. So I'd just like to thank Andrew, Rhonda, and all of you for taking part. It's been a very interesting discussion. We've covered quite a bit today, which is quite good. Thank you, Andrew, as well, for all 3 sessions. They've been really well received, and I'm sure this video will have as many views as the other 2 videos have had, which is tremendous. And hopefully, we can get you back again next year, Andrew, for some more. And we'll try and tweak this slightly to try and get more people interested as well. But thank you, everyone. It's been brilliant. See you all again very soon. Take care.
Thanks, everyone.
Thank you.
Thank you very much indeed.
Thank
Been
you.
brilliant.
Thank you.
Been
Bye-bye.
brilliant.
Yeah, good.